discuss with the general public and see way forward and definitely inform them of the situation of COVID-19 in the Gambia.
Okay.
Thank you very much, Sajane. My name is Sia Omar Silla. I am a lecturer at the Gambia College School of Public Health, and I also take part as a member of the COVID-19 risk communication and community engagement team, the same team with Usman, as far as the COVID-19 response is concerned.
Yeah, well, thank you very much, gentlemen. I'm sure the discussion will really focus more on vaccination. But briefly, let's look at the COVID-19 situation in the country. Is COVID-19 all over? Like it's done, bye-bye to the disease?
We can say COVID-19 is not over because we still reporting cases. And I know at a certain point we are reporting higher number of cases of COVID-19. But in the recent weeks, we've seen those figures have actually gone down. But, you know, in the Gambia, we know most of the people that are coming forward for testing are those that are traveling. So many people are not coming forward, which is a challenge. That's why we still report less cases. With the most current situation report that we have, that was from the 30th to the 2nd of April, we've realized that we have cases that are coming up because we have 13 cases from those period that we tested out of 727 samples. And that shows that we have a test positivity rate of 1.8, meaning every 100 that you test, you have less than 2 people that are getting positive. And that is a good thing because at a certain point in the country, we are having about 36 up to 50% of test positivity rate, which means that shows that we have more people in the community that have COVID-19 with them. But now I think our national figures stood at 5,914 since the first day we started reporting, which is on the 16th of March 2020. We have 5,914. And that might not be the actual number of COVID-19 because we know we have less people coming forward for testing. And that's briefly the situation of COVID-19 in the country.
Okay, Mr. Silla, you just want to jump in?
Just jump in there. I think it's also important that, like Usman said, the test positivity, we know that the sun has shifted. I mean, in those days, out of 100, maybe 90% of those that are coming out to do the testing are intending travelers. But now we're seeing more people that are within the community that are coming out to test. At least a significant percentage of 15% perhaps, time to time, are the ones that are coming out to test. So that tells us that COVID-19 is still ringed in the community, and we have to do our best to ensure that we are ring fencing, putting up strategies to ensure that we don't have not allowing COVID-19 to multiply in the society. So COVID-19 is still around, and we've worked so hard to suppress the virus. We are at a level where we cannot be fatigued anymore. This is not a time to be response fatigue. I mean, all over the world, most countries are already fatigued with response, but we cannot take that opportunity to be response fatigue as far as Gambia is concerned. And that's why the Ministry of Health is still on issues. We're trying to make sure we have best strategies for containment efforts. Coordination meetings are on. And the advocacy, the messages are still very clear, testing, and communication to sensitize people to talk about COVID-19 because it's still here, it's around, it's a reality, COVID is here. A lot of our people have died of COVID, and we don't want to see more people dying of COVID. So it's important to also notice that, from the situation report, Usman has a reference to about 300 active cases that is recorded. I mean, these are the people that we know are actually positive of COVID. So the multiply effect, the design effect for that is perhaps you have times 3 of that in our community. So we can say almost, if we have 300 active cases being recorded at the level of ministry, when we apply the design effect, we're talking about some 900 or 600 more people who did not test but are in the community, because we know that the R naught for COVID-19 is 3, and that is every one person who is positive of COVID is able to transfer to at least on average 3 other people. So we're seeing that the multiply effect is about a 900. If we are having 300 active cases today, we can suggest to say that about 1,000 more people are in the community who are COVID positive and they don't know their status.
Well, I think, still now we all need to pay attention to COVID-19. And of course, let us not forget about the guidelines. Put on your mask, wash your hands frequently with water and soap. And of course, with sun, hand sanitizers and stuff like that. There seems to be light at the end of the tunnel with the introduction of COVID-19 vaccination. And of course, the excitement Gambia is no exception. It is a welcome development in not only in developing countries, but of course in developing and the least developed countries where the worry of COVID-19 has been very, very heightened. Like I said, coming back home, how is the vaccination going on? So far, so good.
Yeah, thank you. I think as of the 2nd of April, like you stated in the situation report, we've actually realized that we've vaccinated about 20,833 people. And these are not just health workers, because initially the plan was to vaccinate just the health workers first. But eventually more people were coming in, and we are opening the bracket for the priority groups. This include people that were having other conditions like asthma, hypertension, diabetes, and we also vaccinated a lot of teachers and also the military personnel, the security forces, and that a lot of people are also coming forward for the vaccination for the purpose of traveling. Because we know in the long run there will be a time when you will be asked to provide a vaccination certificate before you travel. And although we have some issues here and there, but right now people are responding well to the vaccination. People are coming forward because of the message. Because before the introduction of the vaccines, we have a lot of information that was coming around that if you take the vaccine you will die, if you take the vaccine this will happen to you.
And exactly, what sort of vaccine do we have available in the Gambia?
Yeah, in the Gambia we're using the AstraZeneca vaccine, which is manufactured in India, the Serum Institute of India, and this is the vaccine that we're using in the Gambia. And we know the vaccine have 2 doses. You take the first one, and the second one is between 8 and 12 weeks. You should take the repeat dose. And we know when you take the vaccine, it gives you some level of protection, and some scientific evidence have suggested about 68% for the first dosage, which means with the second dosage you can have a higher protection. But yes, still we should not be so excited for the fact that we get vaccinated and forget about the preventative measures. The vaccination goes along with the preventative measures, because we know we have a lot of people in the communities that still don't get vaccinated. If you think that even if the data suggests that if you are vaccinated, you might not be able to have a severe illness, but it is not yet confirmed whether you can transmit to others. So right now, if you have the vaccination, still you need to make sure you follow the other preventative measures, like say Omar did mention.
Okay. And,
yeah, that's important. My interest is with the figures, because if you look at the World Bank's record for the population of Gambia at 2.3 million, and you look at the number of shots that have already been issued as far as the AstraZeneca is concerned, I mean 20,000. Figuratively, we're talking about 1% or less than 1% of the population vaccinated, and the target is to ensure that at least 80% of the population is vaccinated. So we have a race to run. We have about 79% more to come out as far as the vaccination is concerned, and that is we're seeking to have at least 1.8 million doses to cover up for the 80%. Because the whole world is racing for herd immunity. This is an epidemiological idea to ensure that at least those other underprivileged that could not have the vaccine will be protected against this COVID. So with Gambia, I think we're doing good. Yes, we're doing good, and I'm so much in love with the fact that Ministry of Health has opened up strategies for the vaccination process. I mean, you go to all public health facilities in the country. They are ready-made there. You just sit down and you have your shots. But we really need to inspire more people to come out, because having only 1% of the population vaccinated seems to be a very much low figuratively, and when the target is up to 80%. And we know that if you look at the national health statistics for some disease ailments, you're talking about 300,000 Gambians who are living with comorbidities. I mean, these are people who already have other diseases. So where is that 300,000 people? We're having 22,000 now. So where is the rest? And we need to have more people to come out. So let's trust the system. Let's trust the health workers. Let's trust the government of the Gambia. We will never fail Gambians. We will never fail our people. This is our home, and this is what we have.
we remind you that you're still following COVID-19 program here on the GRTS. Equally, the program will be aired on Star TV, Paradise, iAfrica, MTA Gambia. And we're talking about the AstraZeneca COVID-19 vaccine. This will bring me to this issue. What is the duration between the first and the second shot? because this is very important. Sometimes people might think that just taking the first is enough and that's it, you will walk away and you will feel you are safe. And why the need for people to go for the second shot?
Yeah, I think that question is very, very important because we know in the market we have different type of vaccines. And for some vaccines, there are some vaccines that you can take only one shot that will protect you. But the
That's the Johnson & Johnson?
Yeah, Johnson & Johnson, for example. What we're using in the Gambia is the AstraZeneca vaccine, which is 2 dosage, like we stated earlier. Between the first and the second is 8 weeks, roughly 1 month. And 8
weeks will take us to 2 months.
Yeah, roughly 2 months. So,
but it's 8 weeks.
8 to 12 weeks.
8 to 12 weeks.
So if you're gonna get on the 8 weeks, you can have up to your 12 weeks. You have 2 extra weeks to get this vaccine. The reason why we have to take this second dosage because every vaccine goes through trials, and to know the efficacy of this vaccine, and measures are being put in place to know which strategy can best give you that efficiency that we want in this vaccine. So that's why when you take the first shot and during the trial they realize that you need the second shot to make sure that you have that high efficiency, because we want to make sure you are protected against COVID-19. Yes, if you get the one shot, you have some level of protection, but that is boosted when you get your second dosage as being prescribed.
Okay.
Very well. Just like to give it a very good analogy, that is, for example, if I am sharing money and I say, those that are coming on the first queue, you'll have a $50, and if you come back to this queue, I'll give you $100. I mean, everybody want to come back on the second queue to take the $100. So that's just the analogy for the vaccine, because you take your first shot. I mean, the safety and efficacy is about 60-something%, and you take the second shot, it boosts you up to 90% or somewhere around that end. So that is what we need to ensure that most people are protected, most people are safe, because COVID is here. It's not going anytime soon. We are not seeing the signals of COVID leaving Gambia or leaving the world. So it's about time that we try to cohabit with the COVID. And the best way to do that is to understand that we need to adjust as a human race, as a people, because it's no more going back to the normal as to how it used to be. The sun has shifted. Now we have to enjoy another tune when it comes to disease prevention. I mean, the world is going on with face masks, and I keep telling my people that I'm not even sure whether these face masks will go anytime soon, because it is almost attitudinal now to the healthcare workers. And then this is one of the lessons about, I mean, the good lessons, the COVID obviously will enjoy from COVID-19, as in strengthening the healthcare system and ensure that we are very much careful when it comes to cutting down the chains of transmission in healthcare facilities or in communities.
And I think, well, you see, the issue of only 1% of our population benefiting from the vaccination, to me, it's a little bit scary, because I think the response is not that, huge. That is from the layman's point of view, for example. Now, initially, we learned that there were targets. The whole trial or scheme was prioritized. For example, you have the health workers, the military. Now, is it possible that, as we speak, for any Gambian, it doesn't matter where you work or which social class you belong to or the profession you're doing, you can just walk to any vaccination center and you will be vaccinated?
Let me jump to answer that before Osman comes in. Obviously, yes. Like I said,
like the woman selling charcoal at the Latrikunda market, the Jaikati saw at the Johnson Cow, can just wake up one morning, walk to the nearest health facility, and then ask for the vaccine. So
the Ministry of Health has a perfect strategy. I'll say that when it comes to the COVID-19 rollout vaccines. In other countries, you don't have the opportunity of walking to a public health facility and get your shots. And in other countries, you have to pay before you even get your shot. But absolutely free of charge in the Ministry of Health. You don't. The only money you need to spend is just to pay a fare for a taxi to go to the facility or walk to the facility. But no charges are levied for one getting the shot. And definitely the strategies are good, because if you go to the public health facilities, people are stationed there who are supposedly their function is to ensure that those coming in for the services are giving the service as fast as possible. I think the inspiration that we should share, we should keep sharing as a people is let more people come out, because the vaccines are available. They're here. I mean, on the first stock, we have about 36,000 doses, that was available. Now 22,000 is consumed of the 36,000. So we still have more to give. And I'm very much sure that we will never run out of vaccine stock as far as the Ministry of Health is concerned. Because, I would reference that to Gambia's EPI system. We have one of the best models for vaccine strategies. We have a people who are really thinking outside the box, people that we can trust, we can rely on to ensure that this program will never fail. Because if COVID-19 program fails for any country, that is just the end of it.
That would be disaster.
Obviously. We're seeing some of the issues coming out from India. We can take India for an example. Are you seeing, despite the fact that India are one of the giants in manufacturing the vaccines, but today the health system is limping. The health system is almost in shock. And we need to resuscitate their health system. And that's why the whole world is giving support. So in order not to go that far for Gambia to start doing CPR for our health system, is for the population to accept the messages coming from the Ministry of Health and the health experts.
I will still stay on the strategies, perhaps before we move on to the challenges. But do you think that the strategies you put in place is really enough? Or how would I put this? It's so captivating in order to get people to come forward.
The idea is, like I said, some of these issues are attitudinal.
It's very easy to call people, come and receive your vaccine. But is that really having an impact?
Yeah, I think, Selma, let me comment there. I think initially when we started the vaccination, and let's say well before the vaccination, if you go on social media or have a random chat with people, a lot of people were not willing to take these vaccines. But one thing that motivated a lot of people to come forward was the way the vaccine was even launched. The first person to get the shot was the president, then the minister. Then we have our religious leaders taking the vaccination. That really motivated a lot of people. And we started, when we took our vaccine, me and him, we shared on social media. Some people contacted us and they eventually got vaccinated. But we know we have a lot of people are reluctant for the fact that at a certain point, we had this issue of the news of blood clot and all those things. But when that was cleared, we went into the communities now. It's not enough for us to be on TV or on radio, but now we went into the communities to talk to people. Because the reason why they are not coming forward is because of the misinformation that was given to them. But now we want to give them something clear. Yes, it's true that you don't have any medicine. I always tell people, no medicine is 100% safe. Yeah. Okay, even paracetamol has its side effects even adverse effects. The Septrin we take, if you know the adverse effect for some people, it just peel off your entire skin. But that doesn't mean that the medicine is not good. For every medicine or vaccine, we look at the risks and the benefit. And honestly, for you to take COVID-19 vaccination is very, very important. And the benefits there definitely outweighs the risks.
I think that's also important. You've also touched on how protected one can be after receiving the COVID-19 vaccination. Next, I want us to look at the challenges. The challenge is putting into consideration that we are also approaching the feast, that is the Korite, and you see you have a lot of suppers around. Go to most of these major markets, Sarakuna market for example, Brikama, Latrikuna, Banju. You find thousands of people doing shoppings, and the markets are really congested, and we are now even talking about transmission and vaccination. Gentlemen, let's look at some of these challenges.
So very well, I will take it first before I allow Usman to do the expert opinion on it. We know that WHO has really advised for amplifying events. Because this is one thing that is really going to threaten the response power. If the response was a battery, for example, when you continue to have these amplifying events, really the battery is going to go down. So it's important that we understand, yes, it's a feast, the Muslims feast, it's here, and we are always excited to celebrate with our family, and especially in the last 10 days. So we're seeing the one tier will obviously start very soon. But we have to be careful, and COVID is still here. COVID is in the community. It's hiding somewhere. The same way others are running away from COVID is the same way COVID is following us in the community. So we have to be careful. And then COVID is one of the best enemies of the world, because this is an enemy that you don't see. And this enemy is within the society. This enemy is in the community. And you cannot see this enemy.
Absolutely
so you have to be very, very careful towards fighting the COVID. I mean, even having the... We know now we started having the guns, that is the shot, but how would you shoot when you're not seeing? So we have to be very careful with amplifying events. The corridor is coming. So the advice that we will give, I'm sure Osman will talk about that, but the advice we will give is for the continuous usage of face mask. I mean, this is really going to cut down the speed for the transmission of the virus. We ensure that in the market, perhaps physical distancing is not possible to be realistic. But that is why WHO is saying we have to ensure that we're having the face mask, because that is the only thing that we have. I mean, the hand washing is gone. We are no more thinking about it. I mean, when COVID started here in March, you go to the market, you wouldn't even have a bucket. But today, if you go to homes, I mean, almost no home is practicing hand washing. I mean, very few homes obviously are still doing it. But the only chance we have in fighting COVID-19, especially during this time, is the continuous usage of face masks. And this is important. We have to re-energize ourselves in using face masks. But I'm sure Osman will talk about this better.
Yeah, I think COVID has come with a lot of modifications in the world. Look at, you see the way we live traditionally compared to the way we are living now. We see a lot of changes. This is because of COVID-19. And this is something that we didn't expect in the previous 2 years or so. But I think the population now, or people definitely need to accept the reality. It is very, very normal for people to have denial when we have issues like this, because these are issues that are very, very serious. I am used to going out to talk with people or doing my things, and all of a sudden you tell me to stay home. It's very stressful. But now when we see what is happening in the Gambia, if not in the Gambia, what is happening in the world, we should definitely know that COVID-19 is real. So I think what we continue to tell people is to make sure that when you go into the market, telling people to avoid crowd is almost impossible, like say on myself. But make sure you are on your marks. And make sure when you get home, wash your hand. And well before even going to the market, make sure you wash your hand. When you get home, you wash your hand. And for those that are running shops, I think they should also try to limit people. Even if not for COVID-19, you can have a lot of diseases that can spread. And if you have a lot of people congested in one shop, definitely it's not going to be healthy. So we encourage people to continue using the face masks. We encourage people to continue washing their hands. And also, definitely one very important thing is for them to get vaccinated.
And I must confess that go around town, I think it's only the banks that are trying to implement the usage of this face mask. When other than that, you go to other offices, people don't put on their mask.
And very well,
that's the saddest thing. It's only the banks, and you need to commend banks in this country for that. Because this morning I was at the bank, and I was asked, to put on my face. In fact, the fact that you entered the bank and you see everybody putting on Facebook, you feel odd not to put on a face. So we have to commend the banks in the fight against, COVID-19.
Very well. These are some of the activities that are really going to energize the response power. When we see institutions as in banks or schools enforcing some of these things, is really going to support the response energy. But otherwise, what we must avoid doing is to frustrate response power, because it is very much disastrous at this moment. We know that we've had a lot of pressure on the COVID. The powers are gone. We don't have the power anymore. We need to recharge the battery, but it's going to be very difficult if we start suffering surges of cases in this country. If we start having cases coming from left, right, and center in this country, it's really going to be very much difficult, because our health system is not dual track to be able to accommodate for COVID-19 and other care cases. So this is really going to be difficult for us. And that's why we all need to come together as a people, as a country. Let's support each other, because shared vulnerability requires and we responsible. We have to come together and know that the sun has shifted. I keep saying the sun has shifted, because for us healthcare workers, I mean, if you look at the history down the line for COVID in this country, it's very interesting. I mean, we are very much careful. We are very much lucky too that I think the Minister of Health is leading the fight perfectly. Because you look at other countries, the strategies that are employed, and look at Gambia's strategy for the fight against COVID-19, it's excellent, it's superb. I mean, we just have to keep thanking every healthcare worker who was down there on the front line, sacrificing their lives, up to this very moment, sacrificing their lives just to save people from getting the COVID, just to save other people from getting more serious into the use of COVID, just to say, we continue to say salute to those people who are on the front line from day one to today. I wouldn't name names, but I mean, I know that there's a lot of healthcare workers, and specifically to health promotion, the Director of Health Promotion and Education, they did extremely well as far as the fight for COVID is concerned.
Do you think that our I know you want to come up with something, but just let me just ask this question in case I don't forget. Our health facilities in this country, are we well prepared for a surge in the disease?
Yeah, I think like I always say this, no country in the world is definitely prepared to handle surges of cases of COVID-19. Let's take, for example, countries that we believe have one of the best healthcare systems, like America. When they were having cases, at a certain point, even the doctors were coming on social media to cry out that they have a lot of issues that are within the health facilities that are not solved. You look at India now, you have ambulances with patients that are on oxygen, not just patients that are just sick, but patients that are on oxygen queuing for admission, when doctors have to come out and see which one they can take in. And the families now are storming the facilities for them to forcefully admit, but there are no spaces. So in the Gambia, we know our health system is already stretched. That's the reality. But for example, in the malaria season, you go to a facility, you stay there for a longer period before you get treatment, because many people go to the facility at that period. So now if you have COVID-19 on top of the problems we already have, definitely no country in the world is definitely handled, and Gambia is no exception. We will not be in the position to handle the surges of serious COVID-19 cases as other countries are struggling. That's the same way we will struggle when we have surges of COVID-19 cases, especially serious infection. In the Gambia, we know most of our cases are asymptomatic. I think that's something we continue praying to have, which means you have the virus, but you don't even develop any feeling of being sick. I think that's one thing that is helping us. But if you have serious infections, you have more people on oxygen, it's definitely going to be a problem.
We will all agree that Gambia registered significant progress when it comes to managing COVID-19, and of course, trying to make sure that most of the guidelines, the measures have been observed. Together, how can we maintain that development or that progress that we have already achieved from the government level? When I say government's level, I mean from the ministry to institutional levels like other institutions to individuals. What do we need to do in order to maintain that progress we have registered in the fight against COVID-19?
Yeah, I think the first thing I would talk on that is the measures that we prescribe. We should not just be preaching measures, wash your hand or do this. We should try and implement it. And one of the things that we should continue doing is informing people. Because we know we are in the social media age. Every now and then you see messages that are coming forward, and people are bringing in information that are not factual. So we have to make sure we give people the correct information. Because if someone is informed, there will be no need for you to tell you, if you are entering the bank, you must wear a face mask. The person will wear a face mask from home. The moment the person is leaving home, the person will wear a face mask and definitely come with that face mask. Like I always tell people initially when we had that restriction, people will see police and they start wearing masks. That's what we don't want. We want people to be informed, for them to be able to willingly follow the prescribed things. And secondly, we also, at the government level, I think the commitment need to be reinforce the commitment to make sure the facilities are well established. Facilities, I mean the resources, both human and the material resources in the facilities. And because we know before COVID, when COVID came, it took some of our people from us. Because we know you are in the facility, but you are withdrawn to go and care for COVID-19 patients in the facility. So with that, you have gaps that are there. So we want to the government to continue committing the human and the material resources. The funding that is needed. I think if that is maintained, the information is maintained, and the response also is maintained, definitely we will be able to.
Because this program is even part of that information sharing.
Exactly.
I'll just jump on. I'll just jump on to add on to Usman. And for me specifically, I think the government needs to put more support. I mean, the government needs to assign more support to the fight against COVID, and not just COVID, but I think COVID-19 has taught us a good lesson. If only we are learning our lessons as a country to prepare our health systems better, because if you look at all countries will obviously sing the one song of saying no country is unprepared. But COVID is here, and COVID has taught us a lesson that we have to strengthen our healthcare system. I mean, for example, in the case of Gambia, it's about time that I keep saying this, we have to dual track the health system. Let's dual track the health system. Let's support to dual track the health system. We need to care for COVID-19 at the same time, care for other diseases. Another infectious disease can come at any moment, and we don't just have to sit down like COVID and to start, mobilizing resources. It's about time that, for example, the government of the Gambia to put up, a national solidarity fund for fighting emerging or infectious diseases like COVID, because anything can happen at any time. Where's the emergency fund? We need to have an emergency fund for this country. It's about time that the government looks into logistical arrangements, for example. We don't have to suffer those days of not having vehicles or not having the human resources to admit, to go and care for patients, but to withdraw, to downsize our facilities and take other people to go and work in other places. These are all things that we need to learn. I think COVID is here to teach a very good lesson, and I am very much sure that the government of the Gambia has learned its lesson. Every Gambian has definitely learned its lesson from COVID. Take it from me that we will keep saying this story. It's already history, and we will keep saying this. So it's about the government of the Gambia. Like Usman said, I'm just emphasizing that fact that it's about time that we keep supporting the health system. The health system needs support. It's very much evident. The Abuja declaration of the 15% going into the health system. These are not just political statements, but it's about human life. It's about time that the authorities sit and give health care workers or give the Ministry of Health what it definitely deserves.
I think that's quite true. We've all looked at it. But let us also filter this whole thing now to the household level.
Yeah, I think when it comes to the household level.
Because they are the target.
Yeah, definitely.
I am the target. Yeah. We are all targets.
Exactly. So we want to break that down. We have the household heads have their responsibilities, and that people also in the household have their responsibilities. And not even the household, the committees at larger committees at village level also the alcalos and the chiefs also have their responsibility. I think that's why one of our targets when it comes to information sharing are the committee leaders. We have the alcalos, the imams, the pastors, and the household heads. We inform them. So their responsibility is to make sure, one, the people within their committee follow this measure. For them giving them accurate information, and also them making sure that the things that they need is available. For example, if you're a household head, you make sure you have a bucket. Anyone who enters your compound, wash your hand. If the person don't want to wash hand, you just march out. Okay, if you have people are going out from your community, just give them masks. From your household, give them masks for them to go out. And also, one thing that is also very, very important, I think that now that has gone down a little, that is the stigma part of it. Okay, as people in the community, when we see someone who have COVID-19 and the person recovered, definitely we should be in the position to welcome the individual back. Okay, it should not be something that we shouldn't stigmatize in people because they have COVID-19. But I think now, because COVID is no longer a new thing, that stigma issue is going down. But these are all our responsibilities, especially for people in the communities.
Well, we just want to remind our viewers that this program is brought to you courtesy of the Ministry of Health with support from UNICEF. And like I mentioned, the program is all about the COVID-19 situation in the country, especially the vaccination, how far we have gone when it comes to the rollout. You've had my guest um, for those brilliant information they've passed on. We also talked about some of the challenges concerning the COVID-19 situation in the country, and of course the vaccine, and of course the upcoming phase, which is the corrective phase, and which is in fact it's now. The whole thing is beginning to start, gathering momentum, because from now towards the very day of the feast, people are out in thousands. Traffics are really blocked. And then we also talked about what we need to do for each time we are out for shopping. Well, gentlemen, I'm afraid we have now come to the very end of this particular edition. And before we go, we just want you to do a recap of some of the salient points of the topic.
So very well. COVID-19 is still here. The 306 National Situation Report that was published by the Ministry of Health indicates that about 22,800 have taken the AstraZeneca vaccine. We have about 307 active cases currently in the country. These are people that we know who have been tested to say that they have COVID. And like I said, when it comes to epidemiology, you're always interested in the ripple effect. You're always interested in the design effect to say, because the reported number for COVID is 3, so that means we will multiply the number by 3, and that is giving us, insight of how much more potentially people who are active carriers of the COVID are in the community. And I keep saying that the COVID-19 is ringed in the community. So what we can do now is also to ring fence so that it will not amplify. And one way of the ministry doing that is the vaccination process. It has not started, roll out, the vaccination into all public health facilities. Walk into any public health facility in this country, you will get your AstraZeneca vaccine absolutely for free. And that is tremendous, because in other countries we are not seeing this happening. In other countries we are seeing people paying, but for the Gambia it's absolutely free. Nobody will charge you, even not from Janekunda, will charge you for paying and taking the vaccine. So COVID-19 is here. It's about time that we take up the responsibility to ensure that we stop the disinformation and the misinformation in the public space, because people, we still have some very few people who don't believe that the COVID is true, but we are fighting. This is a fight, and that's why we are also fighting very hard. But we're winning the game because we are convincing more people to now believe that COVID-19 is real. If you sit in the 1025 situation room daily, the kind of calls that you receive, you know that definitely people are very much informed of COVID-19. And I just want to say thank you and a salute to the healthcare workers. Everybody, but specifically healthcare workers. I wouldn't mention names of healthcare workers, but they've did very well. They did excellent in fighting COVID-19. I think it's about time that we also have a special ceremony to recognize the effort of healthcare workers. I want the president to call us to the State House. I want to go to the State House, to the cabinet. Definitely. Mr. President, call us all to the State House. Yeah. We want healthcare workers, those in the fight against COVID in this country, want to talk to you, want to see you. We want to walk into the State House and also enjoy some of the little benefits of seeing the State House. Maybe there are people who have never been there. We want to sit there.
And the fact that the president can meet you and say thank you very much.
Obviously, we're asking the president. We want to see you. We want to come to the State House. We want to say thank you. Let's talk to each other.
Is already there.
Yeah,
all right,
I think I will still emphasize on the vaccination, because we are out on the vaccination campaign. Like say Omar did mention, it is free, and you can walk into any public health facilities. And recently we've also went out with caravan to inform people about the vaccine, the side effect of the vaccine, the safety of the vaccine. And honestly, a lot of people were coming forward for the vaccination. That's why the ministry is also planning to go back with the caravan, but this time with the vaccination team. Initially the caravan was going, and people were informed to go to the facilities. And but now the vaccination team will go with the caravan. People come in to request for the vaccine, will be given the vaccine. I think for us, our second dose is almost due. We took our first doses, and still we didn't see any major side effects for now. And we encourage people to go and take the vaccine. It is free, it is everywhere. And people who are vaccinated or not should not forget the other measures. Washing hands, use of face masks, and make sure it's possible to avoid crowded areas. Thank you.
Suso Sora is my cameraman. Special thanks to MCR and my sound technicians, and of course, all those taking care of technical business. Momo Dujai is the program director and coordinator. From me, Tijan Jan, I thank you for the time you invest in this particular edition. Until I see you next time. Bye-bye.
party bu nga nuyoo leen say waay ngay dem foofa ca Stroll Company yi daal di la defaral dàll bu dëgër baax te rafet moo xam itam da nga am xew bu nga sa yére nuroog sa dàll demal seeti ñii di Stroll Company te emuñ ci loolu dinañ la defaral sa dàll si saasi boo demee ñi nata la nga toog wax leen li nga bëgg ñu defaral la ko te itam dinañ defar dàll si wholesale wala retail seeti leen foofa si Suncu Alaaji te nag lu ci gën a neex mooy doomi Gambian moo ko moom teg ci di dimbale ay ndaw pour ñuy am fu ñuy xëyee seeti leen foofa ca Suncu Alaaji ca Kunkujang Johnson boo demee rek di nga gis seen tablet nga daal di leen dem seeti sa xol ne nga am sa dàll boo yàgg mi bi mun ngaa nemmeeku seen website bi si www.strollshops.com wala nga oo ñu si 7473692 wala 7150195 ak Stroll Company sa jaaxle jeex na ci dem beeg dëkk bi ci dàll kese.
tey moom dama ne naa ñëw xool si sa tabax gi.
loolu nag kontaan naa si bu baax.
seen nag yow kontaan nga waaye man kontaanuma ndax bul fàtte ne man ak yow ñoo bokkoon nekk bitim réew ma yónnee xaalis bu bëri pour ñu sampal ma suma néeg waaye bi ma ñëwee ba agsi la ma fa fekk sama xol neexut parce que tabax gi àggut fen te xaalis bu bëri laa ci ñàkk yow nag bi ma waxee ne da ngay samp ak léegi yàggut